My name is Dr. Nicholos Nikolov. I'm a plastic surgeon, and I've been practicing here in Beverly Hills at the Nikolov Center for Plastic Surgery since 1994. Morpheus8 is a technology that involves radio frequency delivered by pins into the skin, and the energy exit to plates around, thus heating up the skin and allowing for a great deal of skin contraction as well as significant improvement of the skin texture. The best part about Morpheus8 is a technology that allows me to change the pin length. As a result, I can treat different areas of the face or body with literally changing the length of the tips with a push of a button. I've used Morpheus8 all over the body. I started with using it on the abdomen to tighten some of the skin and improve the texture. Also, one of the things I found is that it also improves the stretch marks on the abdomen. So that's an added benefit. Here we have some topical cream on, and what I use is 23% lidocaine and 7% tetracaine. And it's important to leave it long enough so that after this is taken off, it's also important to clean off the skin well with some saline, because you don't want any residual chemicals, lidocaine, tetracaine, or whatever the gel is, to be left in the skin when we are applying the energy. So wiping the skin alone is not enough. We want to make sure we clean it off with some saline as well. So the first thing I'm going to do, once we clean it off with some saline, is inject the neck and the lower face ready for the Embrace procedure. However, in this case, just to give her an additional bonus and get an even better result, we're going to use the Morpheus8 not just in the area of the neck. However, I'm going to use it on the whole face and the forehead as well. Now that we've cleaned her off with a little bit of saline, we're going to use 70% alcohol to clean off the skin, and that would further disinfect and make sure we get all of that cream off. Okay, so we're going to go ahead and mark you now. So do me a favor and just swallow. And the first thing I like doing is marking the cervicomental angle. This is where I want it to be. This is where hers is. Then the next thing is we want to mark the jawline here. And we see her jowling on top, and we see some of this underneath. Actually coming quite a bit down here. It's important to know occasionally you have the submandibular gland here and it's not jowling, to differentiate between the two. Actually, this even extends a bit more. Now, the next thing is, we know this is the jawline. There is a no-go area about 1 centimeter above and 1 centimeter below. And by avoiding this area, we're avoiding injuring the marginal mandibular nerve, as well as giving nicer definition to the jawline by treating above and below it and leaving the ridge behind. Next, you see the corner of the mouth. Anything that is medial to this is a no-go zone. We do not want to treat that area. So this is the no-go zone. So we want to make sure that nothing is treated here. And for emphasis, I put nice red mark on it. Most of us can remember Don't go medial to that, or you risk an injury. Now we have to do the same thing on the other side. We see the jowling. It's not always symmetric, so don't expect it to be the same from side to side. Same thing for the jawline itself. The jaw is not symmetric on either side, so as long as your markings are correct, don't feel that you have to be, it's got to be perfectly symmetric, because the body isn't. As far as incisions, very simple. We know we have to stay away from this no-go zone. So we are going to put the incisions a little bit below the jawline and outside of this no-go zone. So the incision would be right here. Same thing on this side, the incision will be right here. And I'm simply marking it so everybody can see where it's going to go. Next incision goes right at the crease at the inferior lobule. I don't put it right below, I put it a hint behind, just a millimeter or two, because it hides a little better. And same thing on the other side. An incision in the midline here is optional. Usually you can cross from the two lateral incisions well enough in the midline, and that gives you delivery of enough energy. But if you feel it's necessary to go in the midline, that is a possible entry point. And if you look at her jowling, it's certainly not the same on both sides. You see a lot more fullness here on the right than on the left. And that emphasizes the point I previously made. So you need to be aware of that, and treating differentially is certainly okay. Okay, so now we are going to inject, and this is the Tumescent solution. I use a 25 gauge spinal needle, which I'm able to reach quite far and not do as many sticks. The key is the rate of injection, a little stick. And if you inject slowly and you're patient, the amount of discomfort to the patient is much less. Sometimes, if you have a sensitive patient, the injection takes me almost as long as doing the whole procedure. But comfort of the patient is very important, so don't be in a hurry. So what I use is double strength Tumescent solution, which is 50 cc's of 1% xylocaine with 1 amp, 1 to 1,000 of epinephrine. The amount you inject varies on the patient you're doing. And a bigger face, of course, you will inject more than you would in a smaller face. Injecting more fluid gives you a little bit more safety margin, so you don't have to worry as much. It's more of a heat sink. The heat distributes a bit more, and you worry less about having a burn. However, if you put in too much, it takes much longer to reach the desired temperatures, and as a result, you may deliver too much energy. My recommendation is, starting out, to put in about 150 cc's, give or take 30 cc's, in the neck and the jowl area. As you progress, you can bring that amount down to as little as 60 cc's total for both. And that makes the procedure a little bit faster, and you see the actual contour you're creating a bit better. Here she has a little bit of scarring from a previous procedure that I can feel even just injecting with a sharp needle. And even injecting, you want to make sure you're in the plane you're going to treat, and you don't end up injecting the tumescent solution under the platysma. So this is the first part to make sure that once you get the probe in, it's easy to be in the right plane. Now here we're injecting by hand, which can be an advantage or a disadvantage if you're one that's in a hurry. But you can also use an infiltration pump, whether you've chosen to use the 25 gauge spiral needle or you've chosen just a regular tumescent infiltration needle. The difference is the pump has a consistent rate, and with this you have to be careful not to be overly exuberant and press too much and end up creating discomfort. However, with a pump, depending on the rate, most pumps are set at a much higher rate, so you really have to be able to put it at the lowest setting possible, and it's a little harder to measure the amount you're injecting from side to side or total amount. And here we have the Morpheus8. The beauty of it is we have 3 different lengths. Here we're doing a little bit of extra treatment, so we're going to do Morpheus8 for the forehead and also the whole upper face and mid face. We're doing this before we do the embrace procedure, simply because the effect of the cream will wear off and we don't want that to happen. For the lower face, you have tumescent solution injected to be able to do the neck tight, and then once you end up doing the Morpheus8 on top, patients are already numb for the first procedure, so that's of no consequence. But certainly the upper face, it's much nicer to get it done first while the cream is still working. Okay, here we're going to start. Let me know what you feel. How are you doing?
Good.
On the forehead, I actually use the periorbital settings quite frequently because the tissue is very thin, and especially in thinner patients, you can feel the needles hitting the bone if you use longer needle. So periorbital setting is to be considered in this area, and it's much more comfortable. The other issue is, as we know, there are a few nerves underneath, and if you're going to the bone, you certainly don't want to hit those nerves. A little bit of overlap is recommended, just like in Fractora or most other procedures. This is rather forgiving if you have a little more overlap or less. Fortunately, it's still, the technology is such that it makes you look good and you get a wonderful result. I usually try to have about a 50% overlap whenever I apply this on the face, neck, or body, and that gives you, in most cases, the best result. And it's the same whether you're double stacking or not, whether it's first pass, second pass, third pass. Now I'm going to change the settings here. Now I'm going to the facial settings, and the needle is being changed from 2 millimeter depth to 3 millimeter depth. So here we don't have any bony prominences, so we can go a little bit deeper. Now you may feel this a little bit more, so let me know, and hopefully not. The first one is generally the worst one there, and you did great. And also, just when you think, and we're talking about overlap, where the needles are, it's not the whole piece and the size of the whole piece. The needles are a small portion of that. So you really have to overlap a bit more than instinct will tell you. Now this is a nice ergonomic handle, and although it may look like it's bulky, it allows for a much easier application of energy. So for me, it has been much easier on my hands and wrist. Doing this extra on the upper and mid face, I think greatly enhances the result of the Embrace procedure. And for most patients, I think it's worth considering. Now, as you can see, the downside is the fact that you have a few more broken capillaries the higher you go, and you may see a little more bleeding, but this goes away pretty quickly. Now, for me to do a second pass, which I will, I always do one pass and then do the second one once I've completed the face versus following it right up. I like giving the tissue a chance to recover, see how it's reacting, and make sure it's ready for that second or third pass. And you can do more than 2 or 3 passes if necessary, depending on the energy you're using. We have this set at 40 watts, and you can do any amount of energy that you're comfortable with. It's a matter of figuring out the patient comfort and where they're comfortable and how can you achieve the best result. So you may be more comfortable at 30 watts and doing more passes, 35 or 40. Certainly it's what works for you is the most important thing, and where's the patient comfortable. Now I'm going to make a second pass, and then we're going to start with the forehead again. You still doing okay? Mm-hmm. The forehead, at least for most patients, tend to be the most sensitive area, or I should say only secondary to the perioral area, because we know lips are always sensitive. I'll try to get a little bit more on closer to the eyelid. Patients tend to bruise a little bit more when you're close to the eye, but it's certainly worth it getting the improvement. Now, going to the nose. The nose, you don't want to leave it as an island. It needs improvement frequently because of cartilage and depending on the kind of skin they have. I also frequently go with the periorbital settings. And I like manually pressing the skin against the tissue so that I have good contact. This can help with a lot of the broken capillaries. Now on the tip of the nose, again, I manually press it against so I have good contact for the needles as well as the plates on each side where the energy is distributed. In the glabellar area, you just pull back. And now I'm going to go with the more superficial setting in the upper lip again. Let's go ahead and prep. We're going to do the Embrace procedure. And of course, as part of the Embrace procedure, we're going to finish doing the jawline as well as the neck with the Morpheus8 as well. So now we are ready for the Embrace procedure. And first we are going to use the neck tight, FaceTite. So as we spoke before, the incisions, here's the jawline, and the first incision is going to be right here. And the second incision is going to be right here. I make the incisions with an 18 gauge needle because that's all you need. The probe of the FaceTite neck tight device is rather small, and it's about the same size as an 18 gauge needle. So you don't need a blade, you don't need anything else. So we're going to start with that. The first thing is I want to get in and just feel the tissue. She has a little bit of scarring because she's had a previous procedure. And certainly when I'm doing this is not the time I want to struggle through and make a pathway. So this feels pretty good. Very important that we are between the skin and the platysma, and we're not into the platysma. We'll do that from this side as well. Okay, and through here we can actually crisscross and get the central area very well as go laterally and get the lateral neck as well. I always feel with my hand, I always want to know where I am. So yes, you kind of even see it when you look at the skin where you are, but it's always good to know what's between you and the probe. So let's make the incisions now behind the ear. And as I said, I do it at the lobule, but I do it just a little bit behind. We want to make sure that it doesn't show at all. And here sometimes you have some tougher tissue to go through in the first centimeter, but then it's much easier. And we see we're okay. Okay, let's do the other side. So we've done all of that. Now the next step is do the actual work. So we need to have a little gel. That's conduction, and the only way the radio frequency current can be conducted is if we have some skin, the skin covered with aqueous gel. So now we are ready to start. Our settings are 38 degrees external cutoff, 68 degrees internal cutoff, and the treatment time, I have it set at 120 seconds. We're not even going to come close to that, but that way I don't have to stop. We're ready? If you don't have coupling, this is the ugly noise you hear, but that tells you that you're cut off. Nothing should be happening because you don't have both ends contacting the proper tissue, so it's a safety feature, which is actually great. So if I'm off like this, it won't conduct. Okay, bring up your chin a little bit. And wonderful thing about the patient being awake, they can help. Okay, so here we are. And at this point, I'm not even looking at the temperatures. However, very soon I'm going to start. A lot of people simply use the number of beats for guidance. And this slow beat tells me that I'm not in the ballpark. When I start getting a little faster beat, that means I'm within 2 degrees of my settings. And when I get the fast triple beat, then it tells me I'm cut off. I've already gone there, stop and move on. And I'm trying to make sure I stay in the right plane. And in her case, it's a little more important that we make sure we do that. This is a fast procedure, so don't be in a hurry. Making sure you're in the right place goes a long way. Some subtleties that you will discover, or one discovers as they're doing it more and more, but it's easier for somebody to tell you. If you move slower, you're heating up the deeper tissue, and you hear the sizzle. If you're moving faster, the deeper tissue does not get heated nearly as fast, but you certainly don't max out on the internal cutoff. It allows you more passes so you can heat up and reach the external temperatures that you desire. And that way you can tighten the skin again. Some places, internal temperature is more important. Some places, external is more important, but both of them are. So it's not just one or the other. See, if I do this, I'm heating up the skin much more. If I go slowly, that heats up the deeper septi that tighten, and that's what gives the skin the support to keep it up. So it's not just tightening the skin, it's also holding it up. And you can hear the double beep. Not yet. You hear that? That means I'm within 2 degrees. I've set it at the higher end of what we should have. So if I'm within 2 degrees, I know I'm pretty close. I don't have to wait always to be cut off. And most of the judgment here is you look at the tissue, you don't think just energy. Am I a degree away or half a degree away, and I have to hurry. And it's really surprising how much improvement, Joe? How much improvement you can get, and you can notice with one side being done and the other one not. You notice on this part, I'm trying hard not to be right at where the nerve would be, but it's important to turn the probe in this direction to allow for better definition of the jawline. So as we're doing the FaceTite here, it's important to watch the skin. And yes, occasionally you may get a little bit of a bump or what looks like area that's inflamed, but The goal is to try to avoid that. Those do go away, but it's much better if you never get them. The skin is pretty blanched from the epinephrine, and if you notice a lot of induration in the skin, time to stop. I don't care if you think you need to deliver more energy or not. For whatever reason, the skin has had enough. That's a rarity, and to be honest, in 7 years, I'm not sure I've ever seen the skin be beat up enough that I need to stop. But if you're too superficial, holding it too long in one area, you may see that. I think it's important, if you want to keep it safe, keep moving. If with time it's a little bit faster, if you go a little slower in certain areas because you're getting the effect you want, a bit faster and tightening deeper a little better. However, that's not always necessary, and you can still achieve the same effect being a little bit more conservative. So if in doubt, just move a little faster and you won't burn the skin. Okay, and here we turn up towards the bone to give that extra definition. But you see certain areas are getting a little redder. So of course, that means we want to avoid them and we don't want to go there anymore. That's exaggerated by the fact that everything is blanched. Okay, now for the next thing is I'm going to go above the jawline and try to get the jowling. See, the wonderful part is, again, patient is awake. So they're even willing to help. So you don't need to do a ton. And the key here is trying to be a hero and overdoing it doesn't pay off. All you have to do is just enough and be patient. The radio frequency will do its job, and it takes a little time, but you will get there. Okay, smile for me. See, she's smiling, she's awake, all the nerves are okay, everything is working. As you notice, I always want to have her keep smiling. It puts her in a better mood, and it also puts me in a better mood. But the reason it puts me in a better mood is I can always check the nerve, and I can see if we're getting any weakness there, anything at all. And the patient being awake, it helps me a great deal because she can show me if we're getting to a point where we have an issue or not. So that's the main reason why. Now, the last part of this is liposuction. So in her case with liposuction, all I want to do is just pick up some of the liquefied fat, and having those lipids sit there, they tend to cause irritation and they want to come out. So if you go in and just kind of literally vacuum out whatever may have been liquefied, the patient tends to heal much faster and have significantly less swelling. At least in my experience, that has been very consistent. And the few times that I've decided that maybe I didn't need to do it because others don't, I have found a lot more swelling. So I always like kind of mopping up afterwards. As you will see, not much will come out. The goal is not to do liposuction, Although in some patients you need to do liposuction, but she certainly is not one of them. And even if patients that are very thin, I always do this mop-up, and I'm much happier afterwards. And it's not about reduction of size or liposuction in the way we think of liposuction. Okay. And you see the total amount I've removed. Some of it is fluid, some of it is fat that's separating. Now, one of the tricks to define the cervicomental angle a little better is to go right where you want it defined and go a little bit slower without burning the skin. This allows for some of the deeper septi to contract and pull down on the skin so you get a little better definition. I had already done this, but I just did just a little extra just to give her a nicer look. And although she's lying down, you can already see from the side we have moved the cervicomental angle back quite a bit, giving her a nicer projection of the chin and much better definition. Now we have to do the Morpheus8, and we're done. So here, especially on the neck, but it's important everywhere, to stretch the skin when we're doing the Morpheus8. And this is part of the Embrace procedure. The lower neck and centrally is the area that probably needs the Morpheus8 the most. But always stretch the skin. Here we go. Okay.
Can you talk about what settings you're using?
Here, actually, I'm on 40 again. I'm at 40 watts, and I'm on the facial setting. So the length of the tips is 3 millimeters. If you see certain areas that you feel the skin is too beat up, and again, that shouldn't be the case and it's rare, you can always back off to 35, 30, and you still get a nice result. So we're conditioned to think that more is better. This is one place where that's not the case. And have your foot on the pedal. If you feel like you're not ready for the next shot, to lay it properly in the right position, you can always wait. Or just lift up the device, and a zap in the air is not anything wasted. But when you put it on, you always want to make sure you're at the right angle.
You always want to make sure the skin is tight and you're getting a nice result. And see, now I go in a different direction. Now the beauty of this is even if you miss a small spot, it's not the end of the world, but it's better if you don't. The trickiest part when you have the neck injected and it's blanched, it's frequently it would look as if you have missed a spot, but it just blanched out. But no matter how many times you get it, it won't go away. So don't get tricked and overtreat an area. And perfect example of that is you see this area here. I zapped it for sure a second time, but if you look at it, it looks like a missed area. And even if I zap it one more time, you'll see how it's going to stay. So that's just epinephrine, and it's just the way it blanches out. So don't get too concerned about that. The incision points I just make with the 18-gauge needle. I don't close them. If there's anything to drain, it can come out. Usually there is nothing, but it's such a small incision that you can hardly even see. I don't think it warrants a stitch. If it ever got to be a little bigger, I may put a fast absorbing or a Proline, but that's very rare. I like things draining out, but usually there is nothing to drain anyway. But it's such a small incision, it really is not worth closing. So there is no closure for any of the incisions that we've made because they're so small. As you can tell, the Morpheus8 tightens the skin, improves the texture. The FaceTite ends up tightening the deeper septi as well as tightening the skin as well, and we get nice contouring. Now we're done with both procedures. We're going to clean her off, and then we're going to put some ointment on the skin. Afterwards, a little bit of Zeroform, and it's important to have a compression strap on the chin for support, reducing swelling. And I have patients wear that for 4 days after the procedure. Of course, when they eat, brush their teeth, take a shower, they can take it off. But I'd like for them to wear it as much as they can, which means very few exceptions, and pretty much wear it all the time. After that, they can go back to work, and depending on how big and heavy neck they have, maybe they'll wear it at night or none at all.